Hey everybody. My topic is going to be adolescent and young adult health. Some of the key facts that are noted in this: there's over 1.5 million adolescents and young adults aged 10 to 24 years that died in 2019, and nearly 5,000 every day. Young adolescents aged 10 to 14 have the lowest risk of death of all age groups, but that includes injuries like road traffic things and drowning and all that kind of stuff. Also, some of the facts with their health is early onset of substance abuse and higher risk things like getting sexually active early and that kind of thing. Who's most likely at risk of dying? Survival chances for adolescents and young adults vary greatly across the world. In 2019, the probability of dying among those aged 10 to 24 was the highest in Saharahan Africa, Central and Southern Asia, and Oceania, and that excludes Australia, New Zealand, and Latin America and the Caribbean. The average global probability of a 10-year-old dying before the age of 24 was 6 times higher in those areas that I mentioned than now. Some of the main health issues, obviously injuries, traffic accidents, like I said, drowning was one of the most top causes of death among adolescents, and in 2019 more than 30,000 adolescents, 3/4 of them boys, drowned. So teaching children to swim is a very important thing to hopefully prevent those deaths. Another issue for their health is violence. That's the 4th leading cause of death in adolescents and young people globally. Its prominence varies substantially by world region. It causes nearly 1/3 of all adolescent male deaths in low to middle income countries in the WHO region of Americas. According to the Global School-Based Study Student Health Survey, 42% of adolescent boys and 37% of adolescent girls were exposed to bullying. Also, sexual violence also affects a significant portion of youth. 1 in 8 young people report sexual abuse, violence during adolescence. And then this also increases the risk of injury, HIV exposure, other sexually transmitted diseases, HPV, and all those other kind of things that we know about. Again, effective prevention and response strategies include promoting parenting and early childhood development, addressing school-based bullying prevention, programs that develop life and social skills, and obviously vaccinations too for the HPV, and condoms and those kind of things, birth control. Another issue is mental health. Depression is one of the leading causes of illness and disability among adolescents. And suicide is the 3rd leading cause of death in people aged 15 to 19. Mental health conditions account for 16% of the global burden of disease and injury in people aged 10 to 19. Half of all mental health disorders in adulthood start at age 14. And a lot of them, it's not even recognized. And we all know that in our field that, some people just stay silent and they don't understand what's going on and they just suffer in silence. So with that in mind, we'd want to, of course, increase awareness, ask people how their mental health is, that kind of thing. I know another nurse is going to talk about mental health, so I'm not going to get too far into that. Another issue for these adolescents is alcohol and drug abuse. It just leads to a reckless lifestyle, and then they add driving in that age group, and then if they're drinking and driving, and then the risk of car accidents and that kind of thing. Let's see. Cannabis is the most widely used psychoactive drug among people, with about 4.7% of people aged 15 to 16 years using it at least once in 2018. Alcohol and drug use in children and adolescents is associated with neurocognitive alterations, which can lead to behavioral, emotional, and social and academic problems later in life. So prevention of drug and alcohol abuse in those areas of public health could include population-based strategies, interventions, activities in school, community, family, and an individual setting to help counsel these kids about the dangers of that. One of the other issues that they talked about was infectious diseases. Mainly vaccinating is the best prevention, and hopefully some of the anti-vaxxers with COVID and the pandemic understand the necessity of vaccinating their kids. According to the WHO, this article, infectious diseases like HPV that normally occur after onset of sexual activity can lead to both short-term disease genital warts during adolescence, but more importantly can lead to cervical cancer. So prevention with that vaccination can help significantly. Vaccination against HPV, and it's estimated that if 90% of girls globally get the vaccine, more than 40 million lives could be saved over the next century. So that's a lot of people. But it's estimated right now that only 15% of the girls globally get that vaccine. Another issue is early pregnancy and childbirth. Approximately 12 million girls aged 15 to 19, at least 777,000 girls under the age 15 give birth each year in developing regions. The leading causes of death for girls aged 15 to 19 globally is complications during pregnancy and birth. One of the specific targets of Health Sustainable Development Goals is that by 2030, the world should ensure universal access to sexual reproductive health care services, including family planning, information, education, and the integration of reproductive health into national strategy programs. Adolescents need to have the right to comprehensive sexual education and a curriculum-based process of teaching and learning about the cognitive, emotional, and physical and social aspects of sexuality, to better access for them to contraceptive information and services can reduce the number of girls becoming pregnant and giving birth at too young of an age. Laws that are enforced that specify a minimum age of a girl of 18 can help. Girls who do become pregnant need access to quality prenatal care, postnatal care, especially after that maternal conference with postpartum depression was also a big issue for a lot of women. And then, let's see. They all talk about physical activity. We know that kids need to get out and get exercise, that kind of thing. And so just recommendations are, how this affects our community and that kind of thing is we want our children to be healthy and safe and get their vaccinations and, have a good childhood experience and get to be kids. As a nurse, we can, we encourage people to get vaccinated and, hopefully promote after that maternal conference that more people are followed up after they have their children and just ask if they're having any thoughts of self-harm, that kind of thing. And let's see, I think that is about it. We just want our kids to grow up and be healthy and strong. Thank you so much.